Okay, all right. A wonderful Saturday to all of you who are attending today. I think we shall make a start already. Thank you for joining us in this webinar session today. Perhaps before we start, just some housekeeping rules for all of you. Okay, so the first thing is that you have all muted. We have all muted your microphone today. So if you have any questions or any feedback relating to any parts of our talk today, or perhaps anything relating to pharmacy program in our universities, then you can use the Q&A panel. Okay, and this live session is recorded, will be recorded. Okay. So before we start, I think I just want to highlight our topic today is on meaningful global experience in pharmacy education. And we know, of course, education has no border, and international experiences has always been known to be helpful for students, to develop knowledge, skills, and experience in relation to becoming a better healthcare professional. And of course, today with me, I have two alumni with me, Shee and Joelynn. And unfortunately, Shee is encountering a little bit of technical difficulty at the moment. So we are not seeing her online. So we were waiting for her to, be back online in a while. Okay. But having said, without delay, perhaps I will just have our first speaker, perhaps Joelynn, to share with you a little bit about her experience. So just a bit of background about Joelynn. Joelynn is our pharmacy alumni, okay, graduated down in 2021 from our credit transfer program with University of Tasmania. So, and she's currently practicing as a provisional pharmacist in community pharmacy in Tasmania, Australia. So, Joelynn, you ready to just share with us?
Okay, hi everyone. I'm just going to share my screen now. Yeah, can everyone hear me?
Yes, I can hear you well.
Okay. Hi everyone. So my name is Joelynn. I'm from Kuching, Sarawak. So a little bit about myself. I am an IMU alumni. I was from BP 117, and then I did the credit transfer program from IMU to University of Tasmania, which is in Australia. Yeah. So now I'm currently doing my internship in community pharmacy, and then just here to share with you guys about my experience. Yeah. So sorry. So yeah, I'm graduated from University of Tasmania, Australia. Tasmania is actually an island, which is the state at the most bottom part of Australia, and it is located in the city of Hobart. So on the left side here, you can see this is like the campus, and on the right side here is just some of the accommodation available in the city. Yeah, so the experience overall was good, but normally you have like some challenges. So for myself, it's COVID-19 because when I transferred to University of Tasmania, that was in 2020, and that was when COVID-19 hit the world. So classes had turned into online delivery mode. Even for like exams and workshops and even placements, all of them had to be done online. So like myself and my friends, we found it a little bit difficult to sort of cope with the online delivery, and then also we have to like get used to the different curriculum as well. Yeah. Other than that would be like the weather, because it is quite cold here in Tasmania. Like the average temperature is about 15 degrees or so, and it's pretty dry sometimes. Transportation wise, there are no trains here, so mostly it's on foot. So you've got to walk like from one place to another, or you can take the bus, or you can just call an Uber. But it's a little bit pricey here in Australia to get an Uber. Yeah, and then the next one will be the accent. So especially when the lecturers are teaching or they give their lectures, their accent can be a little bit difficult to understand at times, and they also use like different terminologies in explaining some stuff. Like one interesting example I think would be like, for example, if you want to say like a liquid of like 10 ml, like the locals would say like 10 mils. So like, yeah. So some coping strategies which I found helpful for myself, firstly would be to have a study routine. Yeah, I believe every one of you would definitely have a study routine which suits you the best. But for myself, I find that the curriculum in Australia is mostly on like a weekly basis. So like by the end of each week, they would have like a deadline for you to complete. So for myself, I would try to fit what I can do by the end of the week and also be practical and not to push myself too hard. Yeah. The next one would be like having study groups. So for myself, I found it really helpful to study with my friends because we can like practice the oral counseling, which I believe like every one of you would have by now, and also practice exam questions with one another. And lastly would be being proactive in asking questions, because the study methods here in Australia, they are less spoon feeding, so they will expect you to be more independent in your own study. At first, like my friends and I were a bit lost in like different things that we learn here, but as we start to ask the lecturers questions, we find that they're actually very happy to guide you as long as you let them know what you're struggling with. Yeah. Okay, so next. Yeah, and then just want to talk a bit about graduating and licensing. So in Australia, you get your pharmacy license with APRA, which is short for Australian Health Practitioner Regulation Agency. So there are a few things that you might have to get before getting your license as a PRP. So like, first of all, it's just like English tests, IELTS, PT or others. Next, we will have like first aid and CPR certification. Because pharmacists in Australia, we can vaccinate people, so like COVID vaccines, flu vaccines, or other like whooping cough and others. So you would require this first aid training to certify yourself. And then after that, getting yourself registered with the pharmacy board that I mentioned earlier. And then after that, usually people would start looking for internship positions, which is PRP, either in the hospital or community pharmacies available in Australia. And after that, you would graduate and then start your intern year, which is your provisional PRP, which is a duration for 1 year. And after that, then you will have a board exam, and then you go for full registration as a pharmacist. Yeah. So for myself, yeah, I'm currently doing my internship in a community pharmacy. It is a little bit different from the community pharmacy in Malaysia, because in Australia, most of the medications, they are controlled by prescriptions. So in order to get like a simple, for example, like a high blood pressure medication, you would need a prescription, and it requires like dispensing, similar to what you do in the hospital. And yeah, and also we have like community patients, and we have like nursing home stuff to do as well. Yeah, if you have any questions, feel free to pop it in. Yeah. So lastly, just a little bit about my life in Tasmania. So Tasmania is considered a regional state in Australia, so not like a big city like Melbourne or Sydney. However, I would say that it's pretty chill, and the lifestyle is like calm and peaceful. So if you're someone who loves nature and hiking, then you would definitely like this place. And yeah, so these are just some pictures like from the road trips available in Tassie. Yeah. So yeah, and also a bit about the work-life balance. Like average people work like 5 days a week, and like 9 to 5 would be the average working hours. So a lot of shops also close pretty early in Australia, like 5 or 6 p.m. Then all the shopping would close. So yeah, there's good and there's bad as well. Yeah. Yeah, that's all from me. Okay.
So thank you very much, Joelynn, for sharing your experience. I look at the pictures, I think it looks wonderful. You know, it looks like a very exciting place. Yeah. So Shee, you're back online already? Yeah. All right. Yeah.
Yes, I am.
Yes, sir. All right. So yeah, grateful. So if any one of you have any questions that you'd like to ask Joelynn about, you know, more a bit about experience in Australia, or you know, about the credit transfers program, you know, just remember to pop your questions in the Q&A chat box. All right. So I think our second speakers today is Shee. So Shee is also one of our alumni for from the Bachelor of Pharmacy program, and she's currently practicing as a hospital pharmacist in one of the Ministry of Health hospitals. Yeah. So Joelynn, your slide ready? Yeah, you can start sharing. Yeah.
All right. Is it okay?
Yes, yeah. Maybe
okay.
full screen. You need to go full screen. Yeah. Okay. Okay now. Yeah.
Okay. Good afternoon, everyone. My name is Shee, and I'm an alumni graduated from BPharm local program, and it's very happy to be here today to share about my meaningful global experience, even though I went through a local program. So before I start, I will briefly explain my initial journey on choosing my degrees. So basically after SPM, I'm pretty sure all of us were having the same dilemma on choosing what we would like to do in our future, and that same goes for me lah. So we were thrown with many choices on deciding on going for science or business, and so of course eventually I went for science as that is one of my interests. So I chose to do my foundation in science also in IMU, and after that, after completing my foundation, I was given another choice to be decided for my future, which is what kind of degree I would like to take, and local program or a credit transfer. So in the end, I chose based on my preference, which is mainly I have interest in chemistry, formulation, and also mainly to help people in the society. So that's why I end up choosing pharmacy. And my main factor that I've chosen for the local program instead of our credit transfer is mainly, even though my parents were really supportive in terms of finance or anything, they were extremely supportive, but I've considered that I would like to not add on a burden to my family. So that's why I chosen the BPharm local program. And as you can see, our credit transfer, as have explained by Joelynn just now, there's like partner universities like Australia and New Zealand. And as for me, I went for the local program instead. So these are the mainly the most current that I can find for BPharm local program, in which each semester we are what kind of subjects we have to take, and mainly so I went for the local program, and I actually found out that I actually have a chance to get an exposure in overseas, actually through our research project, which is in our semester 7. So that is why I started to do my own research, and also to see what are the things that I need to prepare in order to obtain a chance to get a partner research project with an overseas, through the overseas. So of course, there are a lot of choices, and also from the types of project that we can actually work, we were actually offered with a lot of type of research projects, from formulation, pharmacokinetic, pharmacodynamic trials, statistics analysis, literature reviews, and many more. And I actually chose a project that I actually really wanted to do, which is mainly about formulation. And that is why the first thing that I did was to approach the supervisor in charge of the project itself, which were Dr. Hira and Dr. Manisha at that time. And we had a little discussion regarding on more to mainly understand more on the project and what are the things that we can prepare before we go for the project. And for this project that I've worked on, it's actually a collaboration with University of South Australia in Adelaide with Professor Sanjay and also Dr. Ankit, who were really nice to supervise us and also help us in any ways, even from terms of the project and also even in our stay in Adelaide. So actually, in addition, I was really lucky because my project, I was able to conduct my project with my other 2 friends, Miss Eugene and also Miss Kishan Kunalan. And both of us, all 3 of us are really excited for the journey together at that moment. So of course, before we ventured to conduct our project, mainly our project was conducted in Adelaide, Australia for 3 months. Mainly, basically our whole project was conducted there, instead of some projects may offer like half project being conducted here in IMU and another half in wherever that was partnered. And for us, our project was mainly 100% was conducted over at Australia. And of course, other than Australia, our batch were actually offered with many choices, and we were really lucky that we had like really a lot of supportive supervisor who actually helped us to obtain the chance to go overseas. So as a preparation before we go to Australia, there were some things that we had to prepare, like in terms of research proposal, visa application, fundings, and also accommodation. And of course, all of this, we had to take our really long time, not really long time, it's just like we need a period to actually really prepare well before we actually even get accepted, and also being able to go to Australia to do our projects. So I wouldn't really go in depth with each of the process because it's a bit lengthy, but I would like to highlight in terms of fundings, IMU actually not only support us in terms of gaining chances in global experience, but we also were given IMU chances in lessening our financial burden through the IMU Student Mobility Program, which is actually really nice, as it can be a little bit pricey for anyone who would like to in this meaningful global experience. But through this program, actually it really helped all of my friends in my batch, and most of us were able to apply for it. So in terms, there are a lot of skills, but I would just highlight some of it. Mainly being independent, as Joelynn also mentioned just now, because we are in another country where we don't have our close relatives or friends. So of course we need to be independent in terms of, not only in terms of our work life, our research project, but also in terms of daily life. And of course the other skills that I've actually enhanced through this project was actually teamwork and also social skills. So basically teamwork and social, why I mentioned teamwork and social skills were because the teamwork that I've seen in Australia was actually really remarkable in terms which I will explain later in a more detailed wise. And also their social skills are really different from us, because in Adelaide, I'm not sure in any parts of Australia, but I'm pretty sure most of the parts of Australia, they have a diversity of culture and diversity of people, and with different types of backgrounds, and they are still able to communicate together and work together, which really amazed me. And that is something that I think is really useful in my current work also, because since we are living in a multi-nation country, it actually really helps with my social skills and also how we can work as a team. So other than that, we also obtain like laboratory skills and also management skills in terms of like time and work, and also problem solving skills too. So I've mentioned, as I mentioned, actually some examples of pictures that I've taken from my experience. And this is a team that we work with in Australia. Actually, our project is mainly working under Dr. Ankit and also Professor Sanjay. And both of them actually allowed us to carry out the project in our own capabilities. So they basically would offer the items and also training required in terms of laboratory management and also equipment wise. And then we were just led to do our own thing so that we could conduct the project. And also but also they would actually supervise us really closely so that we make sure that we are actually in the track of what we would like to do, what we would like to achieve also. So as you can see, in social skills wise, as I've mentioned, their team are consisting on a team of very diverse culture, like from China, India, anywhere from the country, and they actually work together. Even though they work on their own project, actually mainly they are doing individual project, but they have something like team meetings like every week, and we were actually invited to join the meeting and see how they actually communicate and help each other, how to solve the problems, or how to share anything, any memorable things that they can share in during the meetings, which is really an eye-opener. So as I've mentioned about laboratory skills, these are the examples of like equipment that we were given training, which we might rarely see in Malaysia. So that is why I mentioned that laboratory skills were something that we actually really obtained a lot during this whole project-wise. And of course, being able to manage our time and work is also really important, as it is very useful in when we start working in the working life. So of course, not only that we have gained our life skills, social skills, teamwork, actually we also gain a lot of good memories together with the research team themselves, who actually offered a lot of details about Adelaide and also their memorable moments. They even bring us out for a picnic, and it was really an enjoyable memory for us. And for us three, we actually had really good memories by going to small trips or places to visit during our free time, mainly during the weekends. And of course, this would be this actually is one of my most memorable thing that I've ever done in my whole life. So therefore, I would just like to explain that actually, even though I've chosen local program for my degree, I'm actually really grateful that IMU actually have given us many chances, and also all the support that we needed in order to gain a very good meaningful global exposure. So I would like to share, actually we have some available like in-depth write-ups on about my experience, but also there are other students from various batches, previous than us, or even our juniors that actually went to overseas. And yeah, it's actually available in our IMU news website. And yeah, thank you for having me today.
Okay, wonderful. Yeah. So Zishi, perhaps you can unshare. Yeah. Okay. So thank you very much, Zishi, for your talk. I think and I'm sure all of you who are listening, will sort of understand, how exciting the journey for Zishi as well, even though it's a short exposure. All right. Okay. So perhaps I can have Zishi and Joelynn back, on this channel, so that we can have a little bit of Q&A. And I'm starting to see a lot of questions start to pop in. All right. Okay. I think very interesting questions. I think these perhaps more questions more directed to Zishi basically. I think the question is asking, why did you choose to do your research in Australia? Yeah.
Actually, not. I've chosen my research project actually not only based on the place itself. Actually, we were offered with many choices, like as I mentioned, like pharmacological formulation, pharmacokinetic, pharmacodynamic trials on maybe lab rats or anything, or maybe statistical analysis. Or so actually at that moment, my first factor that that actually made me to choose this research project is actually because I would like to gain overseas like a memory while doing my research project. So therefore I actually chose Australia, which mainly this project was working on formulation for anti-cancer drug, which actually is something that I find a little bit meaningful to carry out. So at that moment, there are a few like other places that were offered, like Japan, India. There's also Thailand, and there are many places. So actually, I chosen the project instead of the place first. So that's why I somehow ended up doing my research project in Australia. And also because Adelaide is a really interesting town that I think rarely we would choose to like visit as a tourist. So that is also one of the factors that actually like amazed me to choose Adelaide, yeah, for my research project.
So perhaps I just summarize what Shee is saying. So basically in our semester 7 in our Bachelor of Pharmacy program, the lecturers will be proposing some research projects. So some of these research projects are created basically in collaboration with overseas universities. So, and some of these universities were willing to take in students for a very short period of time, so-called like elective program in that sense. So and for a very short research placement, and of course because it's a collaboration, the other party as well also help in some part of the arrangement, if I correctly, you know, like example, how the students, when what the accommodation, you know, some of the social support when the students are there for very short placement for the research purpose. So the lecturers or faculty will release all this research projects. So students who are interested to embark on the project, and of course interested to actually travel there and conduct the research as well, can speak to the lecturers here at IMU. So if they are happy and they are willing to, and they are happy with the project, and they're also willing to fly over to conduct the research project in overseas, then they can be given the opportunity. And of course we have students who may not necessarily who like to travel all the way to overseas to do the particular research, you know. So we have projects where it's conducted internally in IMU as well. So they can always stay back in IMU, during that period of time. Yeah. Shee, is there anything else that you'd like to add on to that?
Basically, that's a really good summary of what I've mentioned. Yeah. So yeah,
right.
basically.
Thank you very much, Shee. All right.
Thank you.
Yeah, the other questions that one of the participants basically asked, perhaps is more on your choices of pharmacy. Obviously, I know Shee has explained a little bit about it already, but perhaps elaboration a little bit more. You know, why did you both decide to do pharmacy from the start, basically? You know, why do you even select to do pharmacy? Perhaps Joelynn want to share with us first. Yeah.
For myself, it's because I was interested in healthcare at first, and then so I knew that healthcare, there are like can choose a different professions, like being a doctor, a dentist, a pharmacist, or nutritionist, and a lot of stuff. But personally, I like medications. I find them fascinating, like how they affect our body. And also I was looking for like a job which gives me more flexibility in my hours. So I would that at that point of time I thought that, oh, being a pharmacist, I can like work any shifts that I want, and I can be flexible, and I can go to different like industries like hospital, community industries, or even being a sales rep or marketing and stuff like that. So yeah, that's mainly the reason why I chose pharmacy.
Yeah, certainly. Thank you. Shee, what about you?
I think, like as I mentioned previously, like how I chosen pharmacy instead of and other projects are mainly because I have interest in like chemistry. At first, I was interested in chemistry, and then I noticed that I have like more interest in terms of like helping people. So like in the society wise, so that's why I've chosen pharmacy, like specifically instead of like pharmaceutical chemistry and everything, which also offers like some students who are interested in chemistry. That's why I've chosen pharmacy instead, because I know that as a pharmacist we could contribute in terms of like in the society, and also like what Joelynn has mentioned. Yeah, medications are really interested, which is something that I'm really interested to know more about, because like how it actually could help in like the diseases and everything. So yeah, that's why I've chosen pharmacy instead of like other professions. Yeah.
So obviously, I mean, obviously there are various reasons why normally students or pharmacists would end up wanting to be pharmacists. But of course, what you can hear quite sure is that pharmacy normally has quite a wide different types of pathway. It leads you to different types of profession. Like you can hear from Joelynn saying that she had multiple things that she felt that she can do, and that's why she ended up being a pharmacist, because she might be able to enter one of it as it goes, and Shee has a very strong interest in chemistry. I have very common, sort of interests like Shee when I first joined pharmacy program about 20 odd years ago. When I first started, pharmacy wasn't even a popular, and there aren't that many pharmacists at that point of time as well. So I shared a very common interest like Shee. I like chemistry, so I embarked into pharmacy, and without knowing much at that time, there were many career prospects that pharmacists could end up with. But nowadays pharmacy is perhaps a little bit more, people are a bit more aware of what pharmacists are doing, because you can see a lot of community pharmacy around, like Guardian, Caring, and different more and more branches are different opening as well. And of course, in hospital, people will always end up in a pharmacy counter somewhere and to pick up their medicine. So I'm sure it's more aware. But bearing in mind, the pharmacy career can actually expand to companies as well. So, if any one of you are interested into that, and perhaps sometimes also you may enter sometimes pharmacy without having a very specific thought where you end up with. I'm not too sure it does end with you, because when I enter pharmacy that time, I was thinking more perhaps I'll be working as community pharmacy, But unfortunately, I did a part-time for a very short period of time. But then I sort of thought, maybe community pharmacy wasn't sort of my thing. And I have worked as hospital pharmacist before, but I end up being academic. I know both of you are very young in your career at the moment. Do you think that perhaps because listen to you came into pharmacy with a specific sort of thought process, like this is why I like it. Up to this point, do you feel that the pharmacy career are still a satisfying career for you up to this point? Maybe Joelynn want to share?
I quite enjoy community pharmacy. I thought that it would be more of like a retail thing where you sell like vitamins, supplements, and medications. But as I go along this path, I will find that it's actually a good way to take care of the community, like specific patients, because you get to see them every time, like every few weeks or every month. And so they become one of your regulars, and you can actually help them with their medications, and you can teach them like how to use the devices, or even like in normal daily dispensing, you can pick up some errors or some interactions which can be potentially harmful. So actually, I think that it's quite good in the sense that you build a rapport with your patients, and they also appreciate you for being there, just being there every day.
How about you, Shee?
Yeah, I totally agree with what Joelynn has mentioned, like how the society actually really appreciates that our help in terms of their medication. And currently I'm working as a hospital pharmacist, which actually it wasn't even like one of like my, it's not to say it's not one of my choices, but it's something that I would like to try first in the initial of my career. And of course, in the future, anything can happen. Maybe I might end up going for community pharmacy, which initially I wasn't really interested in. That's why I went for hospital instead. And actually, even in hospital settings, a lot of patients out there actually have like not really good knowledge about their medications. They only know how to take it. Sometimes they don't even know really how to take it. And actually, as a pharmacist, by helping them to understand more on their medication instead of just blindly taking a medication, actually really helps them like in the long run. Like even not only patients, even your family members, they actually really appreciate like how we could actually use our knowledge to help them, and actually that's really satisfying. Yeah.
Yeah, great. Yeah, so we are all very happy to be pharmacists, basically. Obviously, we are all very proud to be pharmacists. Yeah. So I think the next questions perhaps Joelynn can help to answer in that sense. So there's this question asking if we did, if someone or a students did credit transfers program, example like University of Tasmania with IMU, will they be able to conduct their internship at Malaysia or even work in Malaysia?
Yeah, definitely you can do that.
Yeah.
I have a friend who did a credit transfer with me. So she chose to go back to Malaysia to do her internship, but she did it at a community pharmacy. I think from what I know as of now, you just need to take the forensics exam in Malaysia, like the law exam. After that, then you can just apply it either with hospital or community pharmacy to get your internship. Yeah. So that's possible.
Yeah, so perhaps just to add on to what Joelynn is saying, what Joelynn said is true. I mean, we have alumni who came back from the credit transfers program as well. If you like to confirm, is that you could actually go to Ministry of Health Pharmacy Board website. So both University of University of Tasmania and our credit transfer partners are all accredited as universities where their degree of pharmacy are recognized by Malaysia. So hence the reason why their graduate, including our credit transfer program graduates, are able to or eligible to actually practice in Malaysia as well. But if they decided to come back to practice in Malaysia, then they will have to fulfill the pre-registration training requirement in Malaysia. So in Malaysia, basically the requirement is that they will have to do 1 year of so-called like internship, which is what we call provisional registered pharmacist training for 1 year, and then they have to do another sort of a mandatory training, and that can happen usually in either in the area of community pharmacy, hospitals, or you can do it in research and development. So more information perhaps can be also found from the pharmacy board website if you needed to have that. Yeah, I think the other question is also relating to Joelynn, is that so I think I can see there's interest in going into Australia or probably, is it possible to get a job in hospital in Australia? And of course, I think the question is asking, why are you not in, why are you working in community but perhaps not in hospital?
Yeah. Okay. So this hospital in Tasmania, so the Tasmania is a regional state first, I would say. So they only have 3 main general hospitals if you want to go for the hospital pathway. And to be honest, usually they would prefer locals. They will prioritize locals. Not to say that we can't get in. There are a few of my classmates who managed to start their internship in hospital. And then another thing would be they have a set of interviews, which can be a little bit tricky because most of the locals, they have done like part-time jobs here in Australia, and they are very familiar with the law and the government, like how they subsidize their medications and stuff like that, because it's very, very different as in terms of how they, like in Australia, they have Medicare, which they sort of provide subsidizes for their medications, and then like state laws and all those kind of stuff. So it is possible to get a job in hospital. It's definitely a chance that you can try getting. For myself, why am I not working? It's because I got my offer in the community pharmacy pretty early, and then I had quite an interest in the community setting as well, so I just chose to go for it. But definitely there are a lot of community pharmacies, after working for like 1 or 2 years, then they will offer a job in hospital as well, so that is not impossible. Yeah.
I think one of the common perhaps questions from a lot of people, or concern from a lot of people who wanted to join pharmacy, is basically employment. Whether at the end of the day, whether you're going to get a job. So obviously both of you has successfully managed to secure your job. Are there any particular advice that you could share to people, so that they can increase their chances of getting an employment? Yeah, example like in Australia or in Malaysia as well. Yeah. Maybe Shee want to start first, maybe? Yeah.
Basically for me, because I went pathway, mainly most of us are just given a chance to try, like chances to actually embark on our training or PRP training first with the government hospital. Actually, it's just based on the placement for that batch itself. So for government placement, there are like 4 times a year. Usually there is 4 batches for a year. So you are able to join. Usually you are able to join for your PRP training, and because we are compulsory to give another year of service, so meaning you have secured like 2 years of like employment for the first 2 years. After the first 2 years, usually it's either you are offered a permanent placement, but that also depends on the availability that they open at that moment, which for me, I'm not too sure too, because I haven't like went through it yet. But for our seniors, yeah, they were offered like interviews to get a permanent placement. And if within that 2 years you were not offered the permanent placement yet, usually you are able to extend the contract first if you would like to like continue your interest in the hospital placement. If you are not interested in continue after 2 years, you can always go hop on to other like pathway like community industry. Basically, for my batch, most of us were really lucky to be able to get our employment here in Malaysia.
Yeah. Mind me asking roughly how much time have you waited, because you said it's like four times a year. Yeah. For your case, how long have you waited before you start your PRP?
Because I've joined the degree program in like for our batch, I've joined the MPU, starting with the MPU studies. MPU is the Malaysian studies that we are required to take. Some of my batches were not able to join the first because I've done it before I go into my degree. So I was able to finish my degree like 1 month prior ahead from the others who are required to do their. So for us, I was able to secure my position in like 2 to 3 months. Like there's a batch that opened in November at that same year that I've graduated. So I was like offered for placement at that year instead itself lah. So for others, they might need to wait another like 3 months because it's a 4 times a year kind of thing. But also it depends on the situation itself also. So
Yes.
I would say around like January, February would have an intake, May, June would have another intake, July, August, September, like that around that month would have another 3rd intake, and the last intake will be around like November, I would say.
Right.
So yeah.
Yeah. So but anyway, just to add on what Shee is explaining just now is that in IMU, we offer sort of like 2 different types of intake. So students may join us in July, or usually end of July or end of June to July timing, okay, where they would start with the Malaysian studies, which are compulsory studies from the Ministry of Higher Education. All right. Alternatively, they could join us in September as well. So if they've joined us in September, they would enter into the pharmacy-related program with the July intake students. Okay, and they will do this Malaysian studies at the end of the program, at the end of the 4 years. Hence, there might be some delay, but this delay is usually just a couple of months. So, and of course, what Shee is explaining is that normally they would be like 4 times a year of recruitment by the Ministry of Health, but this may vary from time to time as well. So graduate might just have to wait for Ministry of Health to provide information when they would start the interview and when they would also start the recruitment and enrollment as well. So that vary. Am I right, Shee?
Yeah, correct. And actually, even in the meantime, most of my batches actually did like part-time job while waiting for it. You can just enjoy your time while waiting for the placement. So most of us we did like some part-time jobs and everything. But also I would like to mention, because my batch was actually a little bit affected with the COVID situation at that year. So of course there were a little delay in terms of that also. So yeah, there are some considerations as well during your own situation. Yeah, based on the situation.
All right. Okay, Joelynn, how about you?
Yeah, I agree with Shee about getting a part-time job because I find that employers really like it if you have a job in a pharmacy before. Because for myself, I've done a part-time job in one of a pharmacy in Malaysia, and then I've actually learned a lot from that one, because you learn a lot of things that you don't learn from the textbooks, and about like communication and learning how to deal with customers and learning how to actually ask the questions that you need to. And also there are a lot of like OTC products and things that you just don't learn in school. So it is very, very handy if you can get some experience. And you can also definitely at the end of your job get a recommendation from your boss, which would definitely help you in the future. Yeah.
I mean, Joelynn, I think they also sometimes adopt is that, I mean, of course, students could choose to always to get entry directly into, overseas. And at IMU, obviously, we have two different types of credit transfers. So we have credit transfers, either options to Tasmania universities or Otago universities in New Zealand. All right. So from your perspective, how do you think the first part or first 2 years of your experience in IMU has actually helped you or supported you, when you transition into the program in Tasmania?
I think the part where we learn the extemporaneous, the lab skills, I think that really helped a lot. Because I think in year 2 or year 1, we have actually an exam for the lab skills. I remember there's this microbiology thing where you have an exam, and then you also do a lot of like creams and ointments and stuff like that. Because when I transitioned to UTAS in 3rd year, I realized that we don't have training for that part anymore. So from year 3 and 4 onwards, we don't do any more lab experiments, and they expect you to already know how to perform those extemporaneous procedures. And so I find that really, really helpful in terms of the lab setup in IMU. I think that's really good, and the exams really train us to be competent in that area. Also, like I really appreciate all the activities that IMU has, like a lot of, for example, student ambassadors is one of the activities which I really, really enjoy and appreciate, because it helps me to be more confident, and also to manage events and organize events and things, which is I think there are more sorts of this type of activities back in Malaysia as compared to in Australia. Yeah, and a lot of like clubs and societies events like IMU Cup and stuff like that. Yeah, they're actually things that I really appreciate and that I miss. Yeah.
So you seems to enjoy or miss a lot about how IMU and the activities that you had in IMU.
Yes. And also before COVID hit, and like
certainly. Yeah.
Yes.
I think interestingly, I think for all your information is that student ambassador program is basically one of the example of an extra curriculum activities. So every year basically IMU would recruit a group of what we call student ambassador. So this student ambassador program will actually helps to build the students' leadership, organization skills, and management skills. So, and this student ambassador will be helping in some of the activities, example, marketing or a function or event organizations, student support activities or such, so in that, the student will also be guided and also be trained by staff members to be able to take up some of this role. So, and of course, training provided for students as part of it to improve their skills in, typically I would say more of the leadership skills and also team working. Am I right to say that? Yeah. So Shee, how about you? Do you join any sort of extracurriculum activities when you were in IMU that you found particularly, useful or helpful or, interesting and fun?
For me, because I was a little bit introverted side, so I focus more on my academics, and the most active thing that I've joined was like joining the IMU Cup, like darts and photography, which is actually just like a little hobby of mine. So yeah, I think mainly in terms of that, I've learned to be more like sociable, like to socialize more with people and everything, which is actually really useful. Because as a pharmacist, we deal with many types of patients every day. So yeah, social skills is really, really important to like enhance on, I would say. Yeah. Mm.
Yeah, I agree with Sushi because working in pharmacy, you face a lot of problems and patients expect you to solve their problems for them. So you really have to be out there even when you don't feel like doing it. Yeah, I agree. Yep.
Yeah. All right. I think obviously, I mean, both of you has undergone a pharmacy program. Do you have any particular advice for people who are, still considering whether they should join a pharmacy program or, where they should do their pharmacy program? Any particular advice on how they should make their choices?
I think maybe consider whether you want to do a local pathway or an overseas pathway first. And then after that, think about what sort of industry that you're interested in as well. I would say. Yeah.
Shee, any
For
particular
me,
advice?
yeah, like what Joelynn have mentioned, of course, you have choices of local and also overseas choices, and it also depends on what would you like for your future. So it depends if you would like to expand in the overseas or in the local, And also, I think in terms of like pathways, actually, as you go into pharmacy, you would start to discover which pathway you would like to go more. Because for me, I wasn't really sure if I would like to go for hospital, community, or industry, or even research or academia. Like even up to like the last final year, like that. Yeah. During our last final year, we were like offered to go exposed to like, as I mentioned, like research projects, industry attachments, community attachments, and also hospital attachments, which were really useful. So for me, I think as long as you are interested in any of these pathways, it is okay to like go into pharmacy while discovering what you would like to do in the future. So for me, even up to the last year, I only like decided on specifically what I would like to do. And actually, even in the future, I might not know, I might actually venture to community or even like academia. Yeah.
It's just out of my curiosity. Do you find pharmacy program a hard program to do? Because that's a common, feeling about, of people. They always felt that, they would ask me whether, is pharmacy hard to do, a course that's difficult to basically do or to pursue in. Yeah. So having undergone this program, what do you find it difficult to undergo, or is there any particular sort of area where you felt that is most difficult, or perhaps part where you enjoy the most?
I wouldn't say that it is very easy. Yeah, because pharmacy, it definitely takes a lot of mind headspace. Like especially, I think when I was starting in pharmacy, I also thought that it would be more of like chemistry, sort of those lab kind of things. But then I realized it is mostly about medications and how they work and how this medication is suitable for this condition. That's what I think now, looking back. So I was actually quite shocked when I realized the amount of drugs that I have to actually memorize to get in my head. So definitely it takes a lot of work and patience to get there. But with like persistent studying and discipline, definitely you will remember, like you slowly remember all the things. But still, yeah, I think it is something worth. It is a good program if you are interested in healthcare and medicines.
All right, Shee, anything to add to that?
I think I would agree on what Joelynn said, like how it actually headspace and everything. But actually, I think the most important thing is as long as you have the interest in learning.
Yeah.
Because even up to now, during my work, basically I work in drug information services center. So the department itself. So every day I'm still learning actually. So as long as you're willing to learn, I think it actually really helps. Like as long as you have the interest to like discover and all the new things every day. So yeah.
Yeah. Yeah, I mean, just to add on or to summarize is that I think sharing, perhaps echoing what Joelynn and also Shee says, I think in any education, we wouldn't say it's easy to go through. Pharmacy is certainly a course that require a lot of persistency in studying. So we do advise on, people who are considering to embark into this education journey in a pharmacy program, think about, is that something that you really want to do? Is it something that motivates you, inspire you? Do you have passion in it? Because I think, I think for all of us here, I think if we are interested and we have the passion and we know where we are going, then we perhaps would be more patient and more likely to be enjoying the journey as well. So I hope, all of you who are attending this session today, and if you are still considering whether to do pharmacy or where to do, you had some ideas, where you could to take home with for your consideration. Perhaps just to, we have one more minute where I would just summarize some of the things that we are sharing today. So just to highlight again, in IMU, we offer 2 different types of credit transfer program. The first one to University Tasmania, and that's what Joelynn has actually done. And we also have the credit transfers to University of Otago in New Zealand as well. But at the same time, for those of you who are not able or for particular reason, not able to attend or join one of the credit transfers program, then if you would still like to have some global experience, then you could perhaps, I know Shee has shared with you, in our semester 7 or even elective time period, we have actually a block of nearly a month to 2 where we actually support and facilitate students if they wish to go to overseas. So Shee has done a research collaboration, so which means she has choose to travel to Australia into one of our partners to conduct her research project. And of course, her research project is written out as a thesis and it's part of a assessment and a part of project that IMU considered, which means we counted as well in that sense, and we supported this. And in IMU, we also try to support the students with some funding. So students could always also apply some funding support, although I'm not saying that it would be entirely enough in that sense, but we are trying our best as much as possible to provide some financial support for students who are interested as well. So if any one of you, would like to have more information about our IMU Pharmacy program, you can always visit our website. And of course, you can also contact our staff members in IMU to get more information. Again, I'd like to thank Joelynn and Shee, for their valuable time today, and of course, have a good Saturday to both of you, and of course to all the participants who attended this talk today. I hope this talk has helped you in gaining some of the insight which we hope to share to you today. Thank you very much, everyone. Thank you.
Thank you,
I think we shall
everyone.
end the session today.